Digital health or digital healthcare is a broad, multidisciplinary concept that includes concepts from an intersection between technology and healthcare. From mobile medical apps and software that support the clinical decisions doctors make every day to artificial intelligence and machine learning, digital technology has been driving a revolution in healthcare. Really, it's about applying the digital transformation through disruptive technologies and cultural change to the healthcare sector. So in this video, we're going to discuss how digital health is changing the world. The video is going to be amazing, so make sure you stick till the end. Before starting the video, be sure to smash that like button and subscribe to never miss out on any of our videos. The digital transformation can improve health for all people around the world, but this is only possible if digital technology is governed in the public interest rather than for private profit, and the health for all values of democracy, equity, solidarity, inclusion, and human rights are put at the core of its design and use. According to a new Lancet and Financial Times Commission report on Governing Health Futures 2030, growing up in a digital world, it might seem that healthcare systems and challenges are local and unique. But there are more similarities than differences. Throughout the world, healthcare systems struggle with affordability, inequitable healthcare access, uneven outcomes, and increasing demand for services from growing populations with longer lifespans. However, in April 2021, a YouGov survey found that the vast majority of people feel comfortable fitting monitoring devices themselves and using new data-driven technologies such as artificial intelligence, AI, to monitor and diagnose health conditions. 85% of respondents said that they would be happy to fit a monitor themselves if advised to by a doctor, and 72% feel comfortable with the use of AI. The era of digital health seems to be well and truly underway. Health organizations all over the world are developing and implementing digital health strategies, and companies from startups to long-established players are beginning to promote digital health. The boom in digital health can somewhat be attributed to the rise in popularity of wearable devices such as the Apple Watch or Fitbit or Garmin. Government health insurance programs such as the U.S. Affordable Care Act (ACA) have also brought about new developments in digital health. Despite technical issues when ACA was initially launched, ACA's objectives included improve the quality of healthcare through technology. For example, this included improving the quality of EHRs and computer modeling used to track healthcare spending. Employing technology and data to improve patient health and quality of care is called healthcare informatics. This enables healthcare professionals to assess new programs, look for areas of improvement within the healthcare sector, and integrate new technologies into medicine. Digital tools are giving providers a more holistic view of patient health through access to data and giving patients more control over their health. Digital health offers real opportunities to improve medical outcomes and enhance efficiency. These technologies can empower consumers to make better informed decisions about their own health and provide new options for facilitating prevention, early diagnosis of life-threatening diseases, and management of chronic conditions outside of traditional healthcare settings. What makes the healthcare industry interesting is that those aims could potentially stand to benefit both patients as well as their healthcare providers. By gathering more data on markers of health from activity level to blood pressure, it's hoped that digital health will allow individuals to improve their lifestyles and maintain good health for longer and so need fewer visits to their physician. Digital health tools could also help identify new illnesses or the worsening of existing ones. By enabling doctors to step in earlier during the course of a disease, digital health tools could help shorten the length of a disease or help ease symptoms before they really take hold. Not only could digital health help improve quality of life, but it could also reduce the total cost of a person's healthcare over their lifetime, trimming bills for providers and patients alike. With access to quality health information and services increasingly reliant on digital technologies and data, the Commission calls for digital access and digital literacy to be recognized as a key detriment of health, and to ensure that every person has safe and affordable access to the internet by 2030. The Lancet FT Commission is the result of 2 years of work from 19 leading experts from 14 countries with backgrounds in global health, clinical medicine, public health, mental health, digital media, ICT, social science, economics, and politics, as well as global consultations with youth groups. Digital technologies offer the extraordinary potential to improve the health of all people around the world, reduce health inequities, close gender gaps, and protect the most vulnerable, says co-chair of the Commission, Professor Ilona Kickbusch from the Global Health Center in Switzerland. The NHS's long-term plan for integrated care systems (ICSs), which will oblige all elements of the NHS to work together, will be critical in delving deeper into partnerships with local authorities and the voluntary sector to tackle health inequalities resulting from COVID-19. Future-proofing the delivery of primary and specialist care, physical and mental health services, and health with social care is a positive step in the right direction. The requirement for ICSs to have smart digital and data platforms by April 2022 should be welcomed, as outlined in the NHS's long-term plan. Digitally enabled primary and outpatient care will go mainstream across the NHS with an aim of providing convenient ways for patients to access advice and care. ICSs will seek to deliver more efficient, joined-up support for cardiology patients throughout the NHS, which in turn can bring together all primary care settings. Today, there's no denying the benefits that digital health offers the healthcare sector. According to an AMA survey, physicians using telehealth has doubled since 2016, with nearly 30% of doctors adopting digital health technology. As technology continues to evolve, this number will only increase, but what are the main drivers for doctors? Like many other areas of medicine, variety, reducing the risk of burnout, and the flexibility to work remotely are some of the main reasons why physicians are adopting digital health tools. However, according to our research, 42% of doctors indicated an interest in some form of digital health, AI, machine learning, health informatics, and telehealth. But only 15% stated having expertise in these areas. This statistic provides a clear illustration of the need to provide opportunities for health professionals working across the healthcare sector to build their capabilities and expertise in digital health. According to a Deloitte Insights, digital health employs more than just technologies and tools. It also views radically interoperable data, artificial intelligence (AI), and open, secure platform as central to the promise of more consumer-focused, prevention-oriented care. Advances in AI, big data, robotics, and machine learning continue to bring about major changes in digital healthcare. Also, alternations in the digital healthcare landscape continue developments in ingestible sensors, robotic caregivers, and devices and apps to monitor patients remotely. According to Deloitte, AI will enable major scientific breakthroughs, accelerating the creation of new therapies and vaccines to fight diseases. AI-enabled digital therapeutics and personalized recommendations will empower consumers to prevent health issues from developing. AI-generated insights will influence diagnosis and treatment choices, leading to safer and more effective treatments. Additionally, intelligent manufacturing and supply chain solutions will ensure the right treatments and interventions are delivered at the exact moment needed by the patient. Many medical devices now have the ability to connect to and communicate with other devices or systems. Devices that are already FDA approved, authorized, or cleared are being updated to add digital features. New types of devices that already have these capabilities are being explored. Many stakeholders are involved in digital health activities, including patients, healthcare practitioners, researchers, traditional medical device industry firms, and firms new to the FDA regulatory requirements, such as mobile application developers. The FDA's Center for Devices and Radiological Health, CDRH, is excited about these advances and the convergence of medical devices with connectivity and consumer technology. All of the major tech companies with a consumer presence are looking to get more deeply involved with digital health, but they're all taking interestingly different paths. Take Google, for example. The company has the most comprehensive and arguably most far-sighted strategy. Like many of its rivals, it has a stake in the health tracking wearables market through Google Wear and Fit, a health platform that launched in 2014 and has been largely overlooked since then. According to the report, the pandemic has laid bare the extent to which societies and their health depend on digital technologies to function and the power of large providers and platforms. Let us know your opinion in the comment section below. This is all for today. Hope you liked the video. Don't forget to subscribe to our YouTube channel. Stay safe, and we'll be back soon with another video.